Do you often worry when you miss your period? Because I do. I always get paranoid even though I'm only one day late in my cycle. Yes, it might be a sign of pregnancy or another medical condition. But in today's episode, we're going to talk about a specific reason why you keep on missing your periods. This topic is going to be quite serious, but we're keeping the mood as light as possible. So don't get terrified and stressed out too much because I'm here to enlighten you about PCOS with what is PCOS, Polycystic Ovary Syndrome and Hormonal Imbalance. Hi there! Looking for something fun and healthy? Come and be in your best shape with us. Welcome to Mr. Pink and Mrs. Blue, where we go on our fitness journey one step at a time. I am Mrs. Blue, Mr. Pink's trusty companion, here to deliver important facts about Polycystic Ovary Syndrome, its symptoms, causes, and treatment. So if you think that this is the reason why you have an irregular period, please keep on watching. Before we begin, if you're new to our channel, be sure to hit the subscribe button and ring the notification bell to keep you updated on how to stay healthy and lose weight. Welcome to our fun community! Let us first discuss what is Polycystic Ovary Syndrome. Polycystic Ovary Syndrome is a hormonal condition that women experience during early childbearing years, and its symptoms can develop as early as the first menstrual period during puberty, and can also be a response to weight gain. How would I know if I have Polycystic Ovary Syndrome? In order to know whether or not you have PCOS, you can set an appointment with your doctor and tell her your concerns. She'll start off by asking your symptoms, medical conditions, and perform a physical examination, including blood tests. Unfortunately, there are no specific tests made to determine if a woman has it. But here are the symptoms one should look out for. Irregular periods. If you frequently experience delayed menstruation, which can be characterized by fewer than 9 periods in a year, more than 35-day gap between periods, and unusual heavy flow. However, irregularity can also be caused by stress and birth control. So if you know that you've been stressed for a few days or weeks already, or have been taking birth control such as contraceptives, these might be the reason why. Polycystic ovaries. Many women with PCOS don't have polycystic ovaries. That's why its name can be quite misleading. However, some have this condition defined as enlarged ovaries with follicles that surround the egg, hindering ovaries to function well. Excessive androgen. Androgen is known as a male hormone, but women have it too. How would you know if you have excessive androgen levels? You can easily identify this one by checking yourself in the mirror. Do you have unusual facial hair growth or hirsutism? Do you have bad acne? Do you exhibit male pattern baldness? If you have these symptoms together with irregular periods, it's time to consult your doctor to know your current condition and the treatments you can do. Mood changes. Because of hormonal imbalance, your mood is greatly affected, making it hard to control most of the time. Weight gain, which is associated with your cell's resistance to insulin, causing sugar or glucose to be stored and built up in your bloodstream. Pelvic pain, mainly caused by polycystic ovaries. This can be characterized by a dull ache or a sharp jolt in your lower belly area. Darkened skin, especially on the neck and armpits, caused by high levels of insulin. These vary between people. Some women who suffer from obesity may have worse symptoms. What are the causes of polycystic ovary syndrome? Well, doctors still don't know what triggers the condition, but these are the hormonal factors that may contribute to your risks of having PCOS. Heredity. Do you know someone from your family who has PCOS? Your mother or your sister? If so, this might be the reason why you exhibit such symptoms that might develop as you grow older. Studies suggest that PCOS might be genetically linked. However, specific genes associated with the condition remain unidentified. High levels of insulin. Insulin is a vital hormone that lets our body use sugar as its primary energy source. But if your body isn't responding to insulin the way it should, chances are more insulin is produced. If this happens, androgen production will increase, rendering difficulty of releasing eggs, or as your doctor calls it, ovulation. Excess androgen. If your ovaries produce more of this, you may experience acne, abnormal facial hair growth, as well as male pattern baldness. Low-grade inflammation. Our white blood cells' main role is to fight infections, and if one has low-grade inflammation, it stimulates polycystic ovaries to produce excessive androgens that later on may lead to heart and blood vessel complications. What are the complications associated with PCOS? Women with PCOS might have the following complications: non-alcoholic steatohepatitis, metabolic syndrome, endometrial cancer, sleep apnea, depression, abnormal uterine bleeding, obesity, type 2 diabetes or pre-diabetes, infertility, miscarriage or premature birth, and gestational diabetes or pregnancy-induced high blood pressure. What are the treatments for PCOS? Treatments differ from woman to woman, depending on her symptoms, age, and desire to get pregnant. However, if you're overweight, your doctor might advise you to lose 5% to 10% of your weight to make you feel better, and also to help your prescribed medications to work effectively, thereby improving fertility. In addition, your doctor may advise you to take the diabetes drug metformin glucophage to reduce insulin resistance, regulate ovulation, as well as for weight loss. On the other hand, if you don't want to get pregnant, she might prescribe you birth control, such as a skin patch or the pill, to lower your risk of having endometrial cancer, keeping your menstruation on track, lessening body hair, and clearing up acne off your face. So, if you're hoping to become a mother, yet you're suffering from PCOS, don't worry, because medications are available for you to be able to give birth to a lovely child. These are designed to match your fertility needs, whatever they may be. If suffering from symptoms stated earlier, don't hesitate to contact your doctor right away to get some help. It's always best to seek medical advice regarding important matters about our health. Did you gain something useful in today's video? If so, go ahead and give this video a thumbs up and share it with your female friends to help us spread awareness regarding PCOS. Let's help one another. Trying to make the best out of fall 2020? Check out our video, Pull Off Fall Nails 2020. Healthy tips for strong nails to achieve perfect fall nails before this year ends. Feel free to visit and follow our Facebook page and Instagram account, Mr. Pink and Mrs. Blue, where we share motivational quotes to help people go through their fitness journey with a positive mindset. That is all for today. Again, I am Mrs. Blue. Don't forget, walk on your fitness journey one step at a time. Mr. Pink and Mrs. Blue, your health gurus, will see you in the next one. Bye!